Welcome back in. Well, as seasons change for many of us, our allergies start to flare up, and that can certainly become an issue, but the same can be said for our pets. Dr. Jerome Williams, our regular guest here from Red Mountain Animal Clinic, along with Dr. Tamisha Hubbard with the Alabama Veterinary Allergy and Dermatology Service, join us to talk about the issues that our pets face too. Good morning to both of you.
Good morning.
Good to see you again, Dr. Hubbard.
Good to see you.
Who do you have here?
We have Nino.
Oh, Nino. It's been a while since we've seen you.
Yeah.
All right. So animals, is it similar or almost just like people deal with allergies?
It's very similar. So animals get seasonal allergies, so certain times of the year their allergies will flare up. And so they'll start having some itching and scratching issues, just as we have nasally, postnasal.
Has Nino ever had problems?
So Nino has never had problems. Now he does have some food allergies. So if he eats something like chicken or beef, then he may start itching and scratching. But with the seasonal allergy, these are inhaled. They can penetrate through the skin, and a lot of the pets will lick and chew their paws. Sometimes they'll break out in rashes on their skin, get red, and those types of things. So that's when we tend to get concerned about what's going on and causing those problems.
I'm curious, so when they're, because Dr. Williams knows he's been through this with me, with my dog Buddy, totally allergic to chicken. Yes. So that's a different kind of allergy, but I noticed when he would, his ears would bother him or maybe lick his paws or something.
Right.
When they are licking their paws, is it continuing to infect?
It
or is that okay?
So the licking, chewing, biting, scratching will contribute to an overgrowth of bacteria or yeast.
I want to interrupt you as we go back to that picture, because
Yes.
I know folks at home are having breakfast right now, and I apologize for that, but what are we looking at here?
So that's an intradermal skin test there. That is the test that I use to identify what allergens cause a problem for the pets.
Is this a cat or
That
a dog?
is a cat with miliary dermatitis. Those are the lesions they normally show when they have seasonal allergies.
And that is from grass and the trees,
Yes.
just like we do.
Exactly.
Wow.
And so when they lick, chew, bite, scratch, then they create these lesions on their skin. We have to treat the secondary infections, but we also want to treat the primary cause, which is the allergy. So we may have to put them on medications to control the itching. You may have heard of Apoquil or Cytopoint, those things that control the itch. And then we can also make a serum for them based off of that intradermal skin test we just showed you.
So it's discovering what they're allergic to first. Are they allergic to different things, or is there one common denominator?
It's several different things they can be allergic to. Grasses, trees, pollens, moles, insects.
Wow.
They can be allergic to human dander, which is us.
Wow, who knew that? Dr. Williams, now when you see something like that, would you automatically refer them to someone like Dr. Hubbard?
Yes, we'll try some routine things in the office. The most common drug used is Benadryl. If you got a flare up and you want to buy some time, you can see your doctor.
Like human Benadryl?
Human Benadryl, 1 milligram per pound.
So that's kind of to get them through till you can get them to the vet?
Yes.
How much would you give an animal, a dog, I guess depending on the size?
It's 1 milligram per pound.
1 milligram per pound.
And you can do that as often as 2 to 3 times per day to try to quiet the symptoms down.
Okay, but that's not long term.
It's safe long term, but generally it's going to be too much of a burden to try to give it continually over that period of time.
Okay.
As Dr. Hubbard was saying, that pattern, the ears, the feet, the rears, I learned that from her as we treated so many ear infections earlier, thinking they were ear infections, and in fact, they were allergies.
How about that? So it had nothing to do with the inner ear problem. It was all, why does it manifest itself in the ears like that?
So we're not really sure why it manifests in the ears. We just know that pets with allergies, whether it's food allergies, seasonal allergies, sometimes flea allergies, can cause the ears to flare up. So they can get an overgrowth of bacteria and yeast in their ears, which is precipitated by the actual allergy.
And I guess as we wrap up, the most important thing is don't let, because it's bothersome, it's hurtful to them, don't let it go on without getting it checked.
Long term, right? So we depend on Dr. Williams to refer to us so that we can get these babies healthy and safe and feeling better for their owners.
All right, very good. Thank you so much. Good information today, Dr. Williams.
Always good to be here. Keep those pets out of those cars when you're leaving. Don't leave them